Welcome to the New Ulm Forum. I'm Ruth Ann Webster with the League of Women Voters, and I'm glad to see you today. We've got a very interesting topic today, a topic that should be of all our community concern. I have Amanda Shucknick with me, and she is the Executive Director of the Brown County Evaluation Center, which is the Detox Center. We'll be referring to this as the Detox Center, and I think you're familiar with their work. This Detox Center, our Detox Center, is expanding their level of care because more and more patients are being admitted with drug addiction and drug addiction, drug withdrawal, rather than alcohol addiction and alcohol withdrawal. And Amanda's going to talk to us about the difference between patients who are dealing with having an overdose of fentanyl or heroin or pain pills, how that's different than people who are experiencing alcohol withdrawal. And like I said, that's the reason it's an important topic, because they're expanding their services to provide a higher level of care because it's needed. It's needed. So, enough of me. Amanda, why don't you introduce yourself and tell folks about your educational experience relative to your work at the Detox Center.
Yeah, I have been at Brown County Evaluation for the last 5 years, but I have 20 years of experience working in addiction and chemical dependency behavioral health. Specifically, most of my time has been in a hospital setting or detox setting.
Good, thank you. Now, about the Detox Center, it's a nonprofit, right?
Correct.
And
yes.
it's been around for a long time, right?
Yeah, they started Detox here in New Ulm in 1975, so we've been in town for quite some time, and our services continue to grow and have been since that time.
And you got a very specific building, right? Okay, and tell the folks who might not know where it is.
Yeah, so we are down at 510 North Front Street in New Ulm. Big white building. You may have seen it on the corner of Front and Minicon. We occupy a little over half of that building. We rent part of it out to Enterprise North. That was juvenile detention, and we closed juvenile detention in 2010. But we recently just did a large expansion of remodeling the building, created more usable space for patients. So we now have 2 day rooms and more single rooms so that it's more comfortable for patients and a little more private.
Okay. So when you talk about, if I walked into one of those rooms, what would it look like? What does a patient experience there?
Yeah, because we are mainly focused on patients' withdrawal and they're there for a limited time, we have simple accommodations, but comfortable. You'll have a bed, a twin-size bed with sheets, comforter, and then a little bedside table. We have clothes for people to change into. We will wash the clothes that they come in. Whatever they need, we can provide as far as personal hygiene items, so no one needs to bring anything with them. We have that all covered for them.
Okay. Talk a little bit about your staff. What type of education and experience do they have? What's their level of training? How many people do you have working there?
Yeah, so we have a medical director. The medical director oversees our operation and our medical license and all of our medication protocols. We have 3 on-call nurses who are RNs who have a passion for working with substance abuse and chemical dependency, and that's kind of their niche. So they're very familiar with the physical symptoms of withdrawal, the medication protocols, and then we have a team of about 20 chemical dependency technicians, and they work day to day with patients, taking vital signs, making sure patients are not sick. If they are sick, treating those symptoms with medications that are authorized by the nurse. And then we have an assessor. We have a staff who completes chemical health screenings, who then is able to work with patients if they are interested on an aftercare program to continue treatment, whether that be inpatient or next steps after they are out of detox and in recovery. So we have a really good, strong team to help people make, the most of their stay.
And people come into your facility in various ways. I know that some people come in after an arrest. Is that right?
Yes,
and
that is right.
And they would be arrested for DWI or arrested for other criminal type activity, right?
Yes.
But that's not the only way people come in.
No, that's not the only way. Sometimes there may be police involvement, but there's no arrest. Sometimes people reach out and they don't know where to reach out, so they reach out to the police department or EMS. They also may have had too much to drink and lost their friends or lost their group, and they're in an unsafe situation, and then they can come that way. They may go to the emergency room, to the nearest hospital, and be experiencing withdrawal symptoms or not understanding what they're going through, or they may be looking for help of they need to withdraw from a substance or be highly intoxicated, and then the staff at the hospital can refer them to detox. We also have had an increased number of people coming in voluntary who just need help. They call us and show up to our door, and we can help them.
Okay. Now, we're here talking because there's really been a shift in the type of intoxication that you've been seeing. Is that right? Why instead of me asking you questions, why don't you you've been here for 5 years. Why don't you talk about what you've observed and what your group is doing about it?
Yeah, so typically people think of detox as just alcohol or DUI arrest, and that still is a majority of folks coming in. About 70% of people are coming off of alcohol. Alcohol requires a medical detox or behavioral detox setting. But over just recently, the last 3 years, we have seen a growing number of people coming in on opiates, on fentanyl, heroin, pain pills. It really is mostly fentanyl, and fentanyl mixed with methamphetamines. That is creating, huge withdrawal symptoms. It's a very painful withdrawal to come off of fentanyl, as well as some people don't realize that maybe they've ingested an opiate or a fentanyl substance because it's been mixed with something else that they ingested. And so we've been seeing people coming in who are experiencing more severe withdrawal symptoms related to that use and requiring more medication.
Talk more about that type of withdrawal. How long it takes. What a person looking at that patient would observe.
Yeah. So someone who has stopped taking an opiate or a fentanyl can start experiencing kind of what we call the flu, a flu-like symptom where muscle cramping, hot and cold, maybe some vomiting, unable to concentrate, feeling sleepy, nodding off maybe if they have just ingested. But it's more like a flu, a muscle crampy type feeling. And those you can be okay going through withdrawal on your own. However, it really helps having medical professional because we have medication that can alleviate those symptoms and make it easier for a person. So there's not a risk of dehydration or a medical crisis going on.
Talk about how much time. I think many people listening might understand how long it takes to sober up from too much alcohol. But can you talk a little bit about how long it takes to kind of move through that withdrawal when a person has ingested fentanyl or heroin or something like that? opioids?
Yeah, so typically our length of stay is 3 days, 72 hours. However, we're seeing some people who are using higher amounts or larger amounts of fentanyl needing to stay longer. Those symptoms aren't showing up right away, or they get more severe as they are at the facility. And we have been having folks having a longer length of stay to receive the medication and to make sure that wherever they're going to next, they are feeling safe, and they are safe if that placement did not have medical services. So part of that and the movement across the entire state is becoming withdrawal management certified, which allows us to closer follow the American Society of Addiction Medicine, which we can follow a protocol to have people stay a little bit longer, to have the right medications with us, and then we would expand to having nurses or LPNs in the facility, and we could then help those people that are a little bit more medically complex or need more supervised services.
Okay, so the move here, which I introduced in the very first sentences, is to become withdrawal management service certified. Now, you know, you are really, as a detox center, you're really a medical facility,
Yes.
right? And so, can you explain? And so you have to be licensed, you have to be certified. Can you kind of explain to people who might not be familiar with it what that's like?
Yes, so we're a 16-bed, non-hospital, yet medical facility, and sometimes that's hard to understand, but we are a social facility, so we do provide medical care, and we're licensed to provide medication. We are licensed through the Minnesota Department of Human Services as a detox facility. The Minnesota Department of Human Services is then licensing people for withdrawal management, which will allow us to bill Medicaid products, Medicaid insurance products. Right now, we cannot, but the withdrawal management certification would require us to have on-site 24-hour-a-day nursing staff, and we could take some more severe kind of people, maybe people who have who are insulin dependent diabetic, things like that, who have medication we're not able to manage now. And then we also then are licensed through the Minnesota Department of Health as a supervised living facility. So we carry 2 licenses, and our process is just upgrading our services so that we can be included in that withdrawal management kind of.
It would be fair to say that it's a higher level of skilled staff, is that right?
Yeah.
So right now, let's say, look back, you said you've got a medical director and 3 RN nurses who are on call.
Correct.
And then you've got 20 chemical dependency tech. Well, you operate 24/7, right?
Yes.
You're always on. So, and then you have an assessor. Is it full-time or part-time?
Full-time.
Full-time. So, as you're moving forward toward obtaining the withdrawal management certification, how would that staffing change?
Yeah, the only thing that would really change for us is we would still have the medical director, still have nurses on call. We would have nursing working alongside our chemical dependency technicians. So we would have either RNs or LPNs working alongside our techs. So essentially, it wouldn't change what we do. It wouldn't change how we do it. We would just have the nurse there to decide whether someone needs a higher level of care, which is withdrawal management, and supervise the medication and things that we would need to do there. So that's really the only difference, but we can take a wider range of people.
Well, and you can start billing Medicare, right?
Yes, we can start billing Medicaid, Medicare, where now we bill the county. The county human service departments are billed, and if someone does not have commercial insurance, we can bill commercial health insurance. And so this will allow the counties to kind of get a break where we can bill the behavioral health fund from the insurance versus that coming from county funds. So essentially, I think the goal is we can take the financial burden off the county and provide services to more people, allowing them to, expand their services perhaps.
And for the 30% of people who are coming in for drug abuse, get a much higher level of service.
Yes.
Now, perhaps I should have started this earlier, but you said counties. And so let's
Yes.
make it clear. I know you're located here in Brown County, here in New Ulm, but how many counties do you serve?
Yeah, I think it's kind of a myth. People think we're just here for people in Brown County, but we actually serve and are contracted with 21 counties in Minnesota. So basically, from the cities south and from border to border, we can take folks from any law enforcement agency, hospital, or voluntary. And so we have a pretty big service area that we service and we work with.
Now, you have a board of directors, is that right?
Correct.
And can just tell people, what their role is and how you draw from the board of directors. And basically, they oversee your work, right?
Yes.
And who are those folks?
Yep, so we have a panel of people, 11 people. They are made up of county commissioners from some of our counties that we work with, the larger counties, Brown County, Nicollet County, Blue Earth, and Martin County are some of them. Law enforcement, because we interact with them, and other city and county officials who make up the board. And they are an excellent group of people who support what we do and what our mission is, and also people who are encountering some of the people that we work with. I mean, in the Department of Human Services is also part of our board and probation, and so they have input of kind of multidisciplinary areas of how we operate, how we can make improvements, and how we can best take care of people.
Well, and you a nice segue for me because you talk about interacting with people who are struggling with drug addiction, especially drug and alcohol addiction. But just for people out there who aren't real familiar with drug use, what should a person look for in someone that they care about in their life, and come to the conclusion maybe this person needs some services? What would you experience as a person observing?
Sure. So if it's a loved one, you typically know your loved ones best and kind of know their behavior. So if you notice kind of behaviors changing, routines changing, personality, mood swings, that's one indicator. Being defensive about things, maybe hiding where they're going or not telling the truth about it. Noticing just a change, or trust your gut. If something feels odd, it might be, or it is. And so just, if you ask them what they're doing, they may get very defensive with you. Any signs of impairment, nodding off during a conversation, not being able to focus, going from, really excited to really depressed, having, mood swings, hiding, money, asking for money a lot, something like that. And, not maybe fulfilling all of their responsibilities, acting like maybe they're focused on something else versus what they should be doing. So those are all signs and behavior that someone may be using. When someone is intoxicated, follow their pupils. If those are, not dilating or dilating differently, if they're real pinpoint. Also, if someone is complaining over a period of time, they may always have a stomach ache or flu-like symptoms, things like that, heightened anxiety. And then if someone has been using and they are withdrawing, sweating, vomiting, low heart rate, low pulse, and overdose, that is a real risk these days. And so if you happen to encounter someone who you think or suspect has been using fentanyl or opiates and they're lethargic, very clammy, difficult to wake up, those are kinds of signs that you should call EMS.
That was my follow-up, which is,
Yes.
okay, you notice someone's having mood swings and they're not telling the truth, and that sort of thing. But when is the point when you dial 911?
Yes.
You know, what do
Yes.
you see when you have to go, this is an emergency?
Yes, it's anything, when someone is difficult to wake up, if they feel clammy, if they're having trouble with their balance, they might be stumbling, that's when you should get medical care. And EMS, the police department carry Narcan, that is an overdose reversal substance that helps with opiate and fentanyl use. If someone has ingested that, they then will respond right away. It does cause them to go into withdrawal, so they may not be happy with you, but they'll be alive. And so that is, when it's beyond something that you can do, getting the assistance of medical help or taking someone to the hospital. And before that, if you suspect someone is using and it's not a medical crisis, following up with social services, calling detox and seeing what resources are available for them.
Talk a little bit about what resources are available to people who might find themselves in detox. You've talked about your assessor.
Yes.
But why don't you tell the people what services are available to help folks who find themselves in this difficult situation?
Yeah. The Suicide Crisis Line, 988, is a great resource not only for mental health, but substance abuse as well. AANA, if you Google either of those, you will come up with a list of local meetings. We work with residential treatment centers, also outreach folks who have peer recovery specialists, who are people who are in long-term recovery, who are there to help guide people and answer questions through what services are available. Calling treatment centers and going through, looking at what resources are available, what is affordable, how to get people in. And so finding a counselor, mental health services, and the internet is great. Also contacting the Department of Human Services. They have an LADC who does comprehensive assessments, and so she's very knowledgeable, wonderful in getting people connected to treatment as well.
Talking about resources, I think, in talking to you, it came as not a shock exactly, but I was surprised to learn that I was surprised to hear you tell me that people are using fentanyl and people are using heroin. Pain pills, I think we've gotten sort of used to that. But if someone out there listening would like to learn more about what you know, let's say you're with a group, or like League of Women Voters, or like Lions, or Rotary, or maybe your church is interested. Are you available to go and talk to people and answer their questions? Because listening to this, people might have other questions. Yes,
you can reach me at Detox. I'd be more than happy to speak to someone and to kind of go through in depth kind of what to look for in substance abuse and what resources are available in your area or your community. More than happy to do that. Any of our staff at Detox can answer questions over the phone. They're all very knowledgeable and compassionate folks of getting people connected to services and getting referrals. So, yeah.
Good. And just one final thing, you're getting some special funding, that's how I sort of alerted this, from the drug settlement money, right? Can you just say just a little bit about that?
Yeah, so the opioid kind of settlement from the pharmaceutical companies, Brown County was awarded funds for that, and we applied, and we did receive a grant amount to work on our withdrawal management to help those folks who are going through opiate withdrawal. We are still working in that process and going through that. That really helps kind of get us, started and being able to help more people that need the help.
And there are people out there who need help, and you're
Yes.
there to help. Is
Yes.
there anything else that you think people are listening should know, except that you're there? You're
Yes.
just there.
We are here. We're here to help you. If you come against stumbling blocks, keep pursuing it. Be persistent. And if you have a family or loved one who might be struggling, come up with a plan first before talking with them. Talk with them with someone else who might not be so emotionally involved. Seek help, get answers. You may not get an answer the first time that you reach out somewhere, but be persistent because help is there.
All right, help is there, and people need help, and
Yes.
you're there. Thank
Yes.
you, Amanda.
Thank you.
so much.
Yes.
Thank you very much for listening.